Jen from Mom's Fit Life. If you have ever felt unsure about your core after pregnancy, this one's for you. Today we're talking about understanding your own diastasis recti, or DR, what it is, why it matters, and how you can start healing the right way. Okay, so diastasis recti is the separation of your abdominal muscles along this midline or linea album. That connective tissue, or that is connective tissue, that linea alba. So nearly everyone who's in their third trimester will experience some degree of diastasis, of that separation. It's your body's way of making room for the baby, and it's totally normal. But what happens during that time and postpartum can really make a difference in your healing. So the part that trips a lot of moms up is healing is not just about that gap. You can still have a gap and be functional and healed. You can also close the gap, but not have that full functionality, and you might still be having some pressure issues. So true healing means your core can manage pressure. So no coning or doming in the movements that you're doing. You can create tension in the linea alba when needed, and you can be strong and supported in everyday tasks and during your workouts. Okay, you can find a way to self-test for some of that tension and coning and doming in my YouTube channel, so check that out. It's Diastasis Recti Self-Test. How we move, lift, and breathe and function during and after pregnancy makes a huge impact on the core's ability to heal. So if you're holding your breath during movement, if you're ignoring posture or compensating with your back, it can make healing harder after you have the baby. So if you're still not sure quite what to do or how to start, even in pregnancy, you can be doing these things. Master your 360 breathing. It will be harder the bigger the baby is and the further along you are, but you can still practice it, you can still feel it, you can still do it pregnant, and it will help you once you're postpartum and you're now trying to do it postpartum. Okay, you can layer in gentle core activation, pair it with that breathing. Once you've mastered that 360 breathing, start to incorporate it into some of your dead bugs, your bird dogs, things like that. Progress slowly, okay? Take your time with each of these steps. Once those feel easy and you can manage the pressure properly, then you can move into some more strength work and eventually back to heavier lifting or your favorite workouts like running, whatever it might be, okay? But really taking the time to master that 360 breathing, then pairing it with that core work is gonna be the foundation and allow you to have the most success possible. So if you're dealing with leaks or back pain or that prolapse, that weird bulge down there in the center of your stomach, that C-section pooch, whatever it might be, this is your sign to dig a little bit deeper, because healing is possible and you don't have to figure it out alone. So if you have any questions, if you want some help, comment below or email me at jen@momsfitlife.com. And I hope you guys have a great day.